Another common condition I see in the office is called spondylolisthesis. Sometimes people think I'm swearing at them when I see them in the office, but we call that a spondy for short. And what that is basically when we stand up, the bones in our lower back and the lumbar spine typically all have a normal alignment. There's no movement of the spine front and back. A lot of times people say, well, why are you getting standing x-rays in the office? The reason for getting standing x-rays is we're looking for any instability or movement of the spine, and we're trying to find if there is a shift in the spine. In Greek, spondy means spine, and then listhesis means to move. So spondylolisthesis means spine movement. The reason that is important is because if the bone shifts forward, the body's response is to try to thicken ligaments and the bones around the shift, and that can cause spinal stenosis, a video that I've discussed earlier. Schematically, what it looks like is there's a shift of the fourth lumbar bone on the fifth, which is the most common area, and that can cause compression in the back and can cause pain in the back and down the legs. Again, the treatment for spondylolisthesis is very similar to the treatment that I use for herniated disc or for spinal stenosis. I treat people with time, activity modification, physical therapy, and then sometimes we'll offer folks an epidural or an injection to try to help them feel better. If all those things fail and people have back and leg pain that doesn't get better, then we will do a procedure where we will remove the pressure off of the spine, and then we will stabilize the spine so that these two bones don't move. There's many different ways that you can stabilize the bone beyond the discussion in this short video, but it is something to be done to prevent further motion and further pinching of the nerve roots to help the patient's back and leg pain. So that's another short primer on spondylolisthesis. Try saying that 6 times, and I'll talk to you later.